I am happy to be back here, and thanks for all the love and support that you wanted this webinar to be telecast again. A lot of people did miss it, and I'm happy to present the same thing again. But because I'm presenting it again, I'm adding a few more things and making it a little longer today. So thank you very much, and let's start discussing about how to implement REBT and CBT in children and adolescents, specifically REBT, right? Before I go ahead, I need to tell you that I am a father of two children. One is 10 years old and another one is a teenager. It's a 14-year-old boy. So besides being a psychologist, I'm also a father of two children. And therefore, and before I was a father, I had six theories of bringing up children, and now I have six children and none of the theories work. This is what somebody said, but I think no, that's not true. I have two children and almost all the theories work. Why is adolescent care important? It's important because of many reasons. Um, One is adolescents are defined as someone who is between 10 to 19 years of age, as said by World Health Organization. And young people are defined as someone who falls into the category of 15 to 24. Nearly 30% have issues that need urgent intervention. Now, this is the seriousness of the issue. If we look at it, this is the seriousness of issue. And almost half of them need intervention at some point in time. Um, Around half of these children were estimated to have behavioral problems. Now, these are pre-COVID figures. Remember, these are pre-COVID figures. We still don't have the post-COVID figures. They're definitely going to be up, and schools are starting to reopen now. And I think the parents and of course teachers would be reporting us a lot of more behavioral problems than pre-COVID times. There is a high risk of depression, suicide, and anxiety. The onset of depression and anxiety is highest at this age. The number one killer of adolescents is suicide. And there is a high risk of this. There is a high risk of substance use in adolescents. There are many reasons behind that. One being, peer pressure. Their primary influencers are peers. And second, very important reason is their developmental deficits. Because of that, their prefrontal cortex is not properly developed. They do not have inhibitory control as much as we would like them to have, and therefore they engage in high risk behavior. Because of this, there is also a high risk of injuries, road traffic accidents, self and other harm. This is seen in adolescents a lot. If we talk about children, they're not brought to therapy because they have problems, but because they are problematic. If you see these two sets of children, one on the left, black and white picture, we see that the child appears to be depressed or anxious and it's withdrawn, like it's unlikely to create a tantrum. And the child on the right is probably angry, screaming, creating a tantrum. Who would receive attention first? Someone who is withdrawn, shy, or someone who is yelling and screaming and throwing a tantrum? Of course, the squeaking wheel gets the grease first. And that's why children with externalizing problems receive more attention. Externalizing problems such as ADHD, then anger, procrastination, conduct disorder, and so on. So they receive more attention than internalizing disorders such as depression and anxiety. Why is adolescent care important? Let's get back to this. Is the current status of their mental health affects their academic and professional performance at present and future. So if they have any profession going on, which is unlikely, but their academic performance is certainly affected by their mental health. We also see that their current status impacts their behaviors, having lifelong impact on their health and functioning. Say, for instance, this we can see this adolescent driving, riding a bike. Now, if this rider is a rash driver, then it's likely that they might meet with an accident and have a permanent disability. We can also see that the second adolescent is smoking. Now, these behaviors can have lifelong impact on their health and also functioning. Interpersonal relationships, including sexual behavior, sexually transmitted infections, teenage pregnancy, assertiveness, bullying, all these issues are extremely common in adolescents, and therefore adolescent care is very important. There is one startling figure that suggests that there is an average delay of 7 years by the time a child receives professional intervention. Um, Try to think about your own problems in school or a preschool or school. When you were an adolescent, if you had a psychological problem like depression and anxiety or any other issue, how long did it take for you to reach a therapist? Now, that is a clear indicator that we know we do not receive immediate help, right? But if we fail, say, for instance, if we fail at a test, we get a reprimand very quickly. But intervention, it's extremely delayed. We still do not have a rapid intervention. Now, why do we need to use REBT with children and adolescents? There are top 12 reasons. These are by Anne Vernon, who is the past president of Albert Ellis Institute. She has done immense work with children and adolescents. In fact, her books that I'm going to mention at the end of this presentation are a ready-made source of or a resource for using REBT with children and adolescents in any setting. So top 12 reasons are: one, it is developmentally appropriate. In fact, the REBT techniques can be adapted to the developmental stage of the child or adolescent. It helps deal with what cannot be changed. As we know, problems can fall into three categories: something that can be changed, the problem can be changed; something that can be partially changed; and something that cannot be changed. So you need to learn how to put up with it. This is how REBT would help put up with things that cannot be changed. REBT is very problem oriented. In other words, I would say REBT is very goal oriented. Instead of giving them insight into the problem, like what is causing what, we help them achieve certain goals. And that is why REBT is pretty efficient. We also see that REBT teaches emotional and behavioral self-control. So it gives you responsibility of your emotions. It gives you responsibility of your behaviors. And this is why the changes in children and adolescents are much rapid than other therapies where they do not give emotional self-responsibility. REBT also teaches logical thinking and problem solving. Now, why is this important? Is because at a specific developmental stage, children and adolescents do not have a very well-developed logical thinking. And REBT helps you specifically think in a logical way. Now, this counters that developmental deficit. And as you know, children are growing. They do not necessarily have problem-solving skills. REBT techniques teach them problem-solving skills, which is a skill deficit, and that can be filled with REBT. It is briefer, more active directive, so it's also cost efficient. If you look at interventions in schools or interventions with children and adolescents, they could be very expensive. And if some therapy goes on for years and years, and it may really be very expensive for the parents, and they may not want to engage in the therapy for a long time. However, therapies like REBT are brief and they are more active directive, so the children receive them better. It is empowering, educating, so the children become independent of the therapist much faster. It's psychoeducational, so children are ready to learn at this stage, and it's adaptable to different ages, different IQs, cultures, and settings. That reminds me of yesterday's question that we're going to come to a little later, that it can be adapted to all IQs, all cultures, and different settings. So the basic concepts of REBT, if they are clear to you as a therapist, then you'll be able to adapt it to any setting. For instance, I grew up in a rural environment and I had to counsel patients. I knew that they wouldn't understand very westernized concepts. And this is a misconception that REBT is westernized and it cannot be adapted to the Indian culture or the Eastern culture. So I started telling them stories, the children stories, different stories or anecdotes and I started giving them analogies. And now I use hundreds of different analogies in my therapy sessions with children and adolescents, and they quickly get it. So I do not think that REBT itself has a problem, but the way you implement can be adapted to the specific culture. So, use it if you are very clear with your concepts of REBT, you can adapt it to any culture. Even if tomorrow people from Mars come, and if we study them a little bit and what are their irrational beliefs, I'm sure that REBT can be adapted to Martians. Top 12 reasons to use REBT. Again, helps you get better and feel better. See, feeling better is usually achieved by venting out your feelings or talking to someone, receiving reassurance, or probably avoiding something. This is feeling better. Or if you eat something or if you exercise, then you feel better. However, getting better involves reacting more adaptively next time the same adversity happens. REBT helps you do both, which is not only just feel better, but also get better so that your responses are more and more rational and adaptive later on. It can be used in school settings readily, and schools are a very good medium where you can implement REBT effectively. Now let's look at what is the difference. What are the different scopes of, or what is the scope of application of REBT? First is addressing emotional problems, and second is addressing behavioral problems. Third is addressing academic problems. Fourth, developmental problems. Children have developmental deficits, and REBT helps you address them. And disorders like clinical disorders such as depression, anxiety, and ADHD. We can help children and adolescents who have disorders. So we see a whole range of problems that children can be helped with. I think one more application is prevention. Prevention of such problems in future. This is a photograph of our emotional education training program in schools in Nagpur, India. So we have applied the emotional education training program in schools for the last 8 years now. It can be applied to schools for preventing these problems. It can be used in different settings like individual counseling, one-to-one counseling. It can also be used to address parents. REBT can be used to address parents, address school authorities. I think addressing school authorities is very important because they are stressed. They need to have some rules set for all the teachers and children that will help REBT to be applied more effectively. And of course, teachers training. Now, teachers training is also important because teachers themselves become stressed. They do not know how to discipline children. They do not know how to win cooperation from children. And they may not necessarily have an insight into why children are behaving in a specific way. So teaching the concepts of emotional regulation themselves to teachers helps. We also have something called as a teachable moment that can be taught to teachers. For instance, if a child bullies another child, and the best way, what the teachers usually is to give them a consequence. The teachers would probably give the children a consequence of their actions. However, this is a teachable moment. A teachable moment is any adversity where you can teach an REBT concept. So why does this happen is if we understand that children may not have empathy towards another person, the children may not have consequential thinking, the children may have impulsivity. So such concepts can be taught when there is an adversity. I'll narrate an incident about a teachable moment with my son. I was driving and my son was next to me. And there was this song that played on radio, and it had the words about liquor. So we call it daru in Hindi, and that had the words, and they were inappropriate to be heard by an adolescent, in my opinion, at that point in time. So I had this natural urge to quickly change the radio channel. However, I reminded myself that no, this is a teachable moment. I need to discuss about this with my child. So I asked my child, does he know what this liquor means? And he said, yes, it means alcohol, and it is a bad thing. And so first of all, my anxiety reduced that he knows that it's not a good thing to have. But then I asked him, why do you think it is a bad thing? And he mentioned that, people lose all their money with alcohol. And I asked him, good, could you tell me more about this? And he did not know. And now he did not know. So it was a golden opportunity for me to educate him the consequences of drinking alcohol and how it can actually affect all areas of your life. And we just had, I would say, 1 minute discussion, and that was it. And I'm gonna probably remember. He's probably going to remember that every time he listens to the song, he's going to get a reminder of what we discussed instead of getting motivated to try alcohol. So there are many teachable moments that we miss with our children. Let's say we are watching something on TV, somebody hits another person, we see some kind of, psychological upset in the actors. So all these are teachable moments. You need to take them immediately up. Therapeutic relationships. I'm giving you some guidelines about how to establish therapeutic relationship with this population. Learn about the child's and adolescent's interests, what the child is good at. Now, they may want to tell their stories that I won this medal at the badminton competition, and this is the shield I won, and so on. So listen to their stories in a non-judgmental way. So do not say things like good boy, good girl, and bad girl, because these are judgmental statements. And instead, well done, or, you could do better. These are the few statements that you could be using. Show genuine interest in their stories, because if you're not genuine, they're most likely going to understand that you're not really interested, but you're just showing interest. Normalize and instill hope. One of the things that I frequently do is get testimonials from this population about what is their age, what is their grade in the school, and what kind of emotional problems they were struggling with. So when children wait in the waiting room, they read these testimonials and they understand that this is a common problem. I'm not the only one who is suffering through this. Because specifically with internalizing problems, children may not have shared this issue with other people. So normalizing is extremely important. Instilling hope is important, that you will be able to deal with the adversities better. You will be able to learn the skills better. And if you instill hope, specifically in the first session, you're more likely to get compliance in the following sessions. Be very honest about what you know about the issue. Why is it important is because of two reasons. Number one, the moment you open a statement with, I know that you have been brought here because you were caught stealing or shoplifting. And I also know that your father has grounded you for 8 days, right? All right. And so what would you like to work on? And your response is pretty neutral, non-judgmental about the issue. First of all, this gives a very good, it lays a foundation to a very good therapeutic relationship between you and the client. Number two, if you fake it, that you don't know about the issue, and the child finds out that you already knew about the issue, so it breaks the trust. So it's important that you need to be very honest about what you know about the issue. And clearly, this lays the therapeutic relationship stronger. And there are a few attitudes I would like to encourage in therapists who deal with children and adolescents is explain the limits of confidentiality. For instance, whatever we are going to discuss will be strictly confidential, except under the circumstances of, you having a high risk of harming yourself or another person. Now, this is important because the child needs to know that most of the things would be kept confidential. However, you may alert the parents in case of high risk. Be human. Don't just act like a therapist, or don't just act like a parent or a preacher, right? You need to be human with the client. I give an example of salesperson. I say that, let's say this is a pen. When I do workshops with therapists, I ask the therapist to sell this pen to the next person. And I instruct the next person not to be willing to buy the pen. And this therapist or the trainee, tries different strategies. Like, this is a great pen, this was used by Abraham Lincoln, and so on. So, so you use different strategies. You do not intensify the same strategy. You do not become aggressive that, you don't have to buy this pen or I'm going to kill you. You don't get aggressive if the other person does not want to buy the pen. In a similar way, you are a salesperson. You are selling the child therapy, and the child is not willing probably to buy therapy. So you're probably going to use a variety of strategies in order to get the client buy your therapy. Be a salesperson, try different strategies, and stay calm. Remember that your client is the most important person in the world at that point in time. Be flexible, be creative. This is very important. If you're not creative, the children get bored very easily. In fact, I have one client. He has very bad ADHD. He's around 10 years old, and he keeps roaming around the cabin all the time. And we have settled upon, he does not want to tell his symptoms. He does not want me to interrupt at all. So we settled upon something that he's going to make a cartoon strip. He's very smart. So he makes cartoon strips where 1, 2, 3, 4, 5, and 6. There are like 6 different sections that he does. He makes these cartoon strips, and then he tells me about his problems in that cartoon strip. Right. So be flexible, be creative, have self-disclosure, disclose something about yourself. The self-disclosure has to be therapeutic. Just a minute. Let's imagine a situation where the child has been brought to therapy for being caught, having beer with his friends at the age of 12. And then you start talking to the child that, what, I was caught having beer with my buddies when I was 9. Do you think this self-disclosure is appropriate? And if not, why? Can someone please raise their hands and tell me, why is this not appropriate? Or why might this self-disclosure backfire? Anyone? Can you guys hear me?
Yeah, can I?
Yes, please.
Yeah, so maybe I feel it can act as a motivation because some, elderly figure is kind of doing it. So he seems that what I am doing, what I have done maybe can be right and not wrong. So that
Yeah.
way.
Okay. So you're endorsing the patient's or client's behavior. You're endorsing it by self-disclosure. Dr. Amandeep, wow, good to see you after a long time. Go ahead.
Actually, sir, it's Nishant.
Hi, Nishant. Yeah.
Yeah. So, sir, I feel that, he can very well think, okay, this problem is not problematic because after all, it worked out for the therapist. Sir, aren't you sort
Exactly.
of
So the therapist
well,
got away with it.
yeah,
And, I could get away with it too. Okay, it sends
yes.
out a wrong message. Thank you. Thank you, Dr. Nishant. Anyone else? Hitakshi, yes, good to see you too.
Same. Thank you, sir. So he might have think that like I have done it in 13 years. He has done it in 9 years. So I'm like very late. Something like that kind of a thing he might have thought of about it.
I'm a late bloomer. So, he
Yeah.
might be peer pressured into drinking. He might simply ask me, so you had beer at 9, and what age did you try whiskey? So I'm going to try before you. All right. Okay. So thank you. The gist is, a self-disclosure is not helpful in that situation. Remember, self-disclosure has to be done with only one intent, not to kind of boast about yourself, or not to only endorse what the client is saying. Validation and endorsement are two different things. I wish this was a basic RBT workshop. We could have taught about validation and endorsement. However, just because you want to endorse someone, you are doing self-disclosure. This is not appropriate. Another inappropriate way to do self-disclosure is out of your own need to get validation from the client. For instance, you may say, when I was your age, I was even 1 year elder than you. So I won 3 gold medals by your age, and I was always the topper in my class. I feel like you're doing self-disclosure out of your own need to be praised. So do not do self-disclosure for yourself or in an inappropriate way. Be very patient. Sometimes, I have to wait for 25 minutes till the client starts getting engaged in therapy. And this happens with children with very short attention span. Sometimes I spend 3 sessions in only establishing a goal orientation in the client. So I may establish a rapport, I may establish therapeutic alliance, but to have an agreement on the goal, it may take multiple sessions. So be very patient. Do not do not try to speed up the progress of the client by, just rushing through. This is important because we are aiming at reducing symptoms and not eliminating the problems. You're not aiming at curing the patient. You're not aiming to cure the disorder as well. However, it is important to be patient because everyone else probably has been very impatient with them, and there has to be someone who would be patient. Let's talk a few things about therapeutic relationship more. I'm going to be a little more specific now with smaller, younger children. Play games like "Who are you?" For instance, I play a game of "Hey, I am a Shishir. My name is Shishir, and I'm a coach. I teach people how to manage their feelings and actions. Who are you?" So the child answers like his name is whatever, and then he's studying in ninth grade, and then I say, I have a cat and I love cats because they do not care too much about other people's opinions. And then he says, I love dogs because they are very loving and caring. And then tell something about myself again. I love to do photography, and I get very annoyed when people litter on the streets. Now here I've started assessment already. The client responds that I get annoyed when people are unfair to me. So I know already, and then I quickly move on to the next trigger, or probably an emotion or one kind of behavior that I love to do and I hate to do. So you may also mention your behaviors. For instance, on Sundays, I usually don't like to study and I sleep till late on Sundays. And then probably knows that you're pressing on the wrong nerve, but they say that, this is something that I avoid to do. So you're already assessing their behaviors, their thought patterns, what are their triggers by playing this game. Flip the coin. Another way to do the same thing is whoever, whose turn comes, they would tell something about themselves or a specific topic, like I get angry when. Very younger children, you can play with a toy. You can devise a game. A simple board game can be designed that looks like the track of F1 racing, say, for instance, and that has multiple digits on it. And each digit has one instruction. For instance, my favorite memory of childhood. And then another one would be, I get hurt when. Or another would be probably, I do not tolerate this. So with REBT concepts, with specific emotions or behaviors or thought patterns or inferences, you could write on these. And then whenever your turn comes on that specific number, either you speak about it or the child speaks about it. So you can go for 2 to 3 rounds, and then you know that you already have a lot of information to work. But in the meantime, you just not ask them simple questions. You have established a fun way to work in therapy. Older children, you may want to ask what you don't like about the school, what are their hobbies, memories, something you do well, feel sad about. Now, these things, when the adolescents tell you, these can be included in their homeworks. For instance, one of my patients loved to watch Doraemon, and I knew that he mentioned Doraemon 2 3 times. Not that children mention it now, but that time he did. So when he went out, we had already devised a coping statement for him. And when he went out of the cabin, he received a poster that had Doraemon on it. And then there was the coping statement printed just under the figure of Doraemon. Now, it appeared like Doraemon was telling him to think about this or think like this. Now, that became a very effective statement for him. And you know what? He didn't throw it away. He pasted the poster in his room. And that is how he kept reminding himself of the same coping statement every time. So therefore, knowing about their hobbies is a very good way to, to get it into the homework. With adolescents, slightly spend a little more time being empathic. You need to tell them that you understand their problem. Validation is extremely important, that your feelings of anger, feelings of frustration, hurt are very understandable. Normalize them, that many children and adolescents go through these feelings at this age. How he feels about therapy, again, testimonials. You can display testimonials in your office. You give them an example of a coach. Say, for instance, if they don't want to be in therapy specifically, I use the example of coach. If you're poor at math or geography, or if you wanted to learn guitar, what would you do? You would simply join a coach. You tell them that you are a life coach, you are an emotion coach, you are an action coach, whatever. But you are going to train them with specific skills, and they will have to practice. The more they practice, the better they will get. If they're unwilling for therapy, then have a 3-session contract with them. Tell them that let us try this for 3 sessions, and if this doesn't work for you well, then you may drop out. I have seen, and it's also written in the books, that if you give them a choice not to come back, they come back. And this is my personal experience. If you tell them to come back now, you have to come back next week, promise me that you're going to come back, they're naturally going to resist you. But however, if you say that, you have a choice not to come back. However, if you come back, you can learn more and more things. Have a 3-session contract, it most likely works, and they comply for longer. Stay calm, patient when they do not make progress. Accept them unconditionally when they do not make progress, so that you model what is unconditional acceptance for self and others. Use humor carefully. At the same time, do not mock at them. However, you may use humor on yourself or probably a specific thought pattern or a habit. Don't get into power struggle. Sometimes I have seen children to try to put you down. And you might easily get offended that I have to win this battle today, because if I don't, then I won't be able to establish an authority over the child. You don't have to be an authority. You have to be just an effective coach. I explained this model to parents, specifically what causes children's problems. And when parents ask a question, what has caused his depression? What has caused his anxiety? What is causing their anger issues? I say there are 3 major factors that influence a child's problem. So the number 1 factor is biology, that includes your genetics, your neurochemicals, your hormones, your blood sugar level, your sleep, your exercise, and anything that has to do with the physical body and brain at a macro or a micro level. The second important factor is environmental factors. Now, environment consists of events, the specific objects, then people, including parents, the mother, the father, then grandparents, mobile phone, iPad, internet, and so on. So there are environmental factors that contribute to the child's problem. And the third one is the way they think. Cognition includes some variety of things, including their personality, their conditioning, their inferences, their beliefs, and so on. So I will be dealing with mostly cognitive factors. However, we need to get the biological factors in control. And a small part is environmental factors, which is, both of you parents, I would need your cooperation in modifying the factors that are modifiable. So ask for help from parents about modifying these factors. And almost all parents do agree that they are ready to help you in order to help the child. Biological factors, this is specifically for people who do not want to take medication. And I say that one of the factors is, neurochemicals that can be done, managed with medication, if at all you're open to it. However, there are other factors that we need to take control of. For instance, sleep is an extremely important factor that we need to get control of. So modifying as many factors as possible helps you get better results. So we're talking about a psychosituational model where the first thing that we need to look at is the consequences that follow the child's behavior. For instance, the child soils his clothes. This is his behavior. And the parents beat up the child. This is a consequence of that behavior. Now, what were the consequences of a specific behavior? The child learns through conditioning, and they may have an adaptive or a maladaptive response because or owing to a specific consequence they have received. So we can use this information to have favorable consequences for desirable behavior, and through operant conditioning, the child learns to act differently. We may also have what we call as a relief of specific negative stimuli by their behavior. This is a negative reinforcement. For instance, they get to go out if they finish the studies. This is negative reinforcement. These are a few things that I would like to tell. Be very thorough with conditioning, classical conditioning, operant conditioning. So consequences of the child's behavior are very important in understanding the disorder or the dysfunctional behavior the child has. Another factor that influences the child's behavior or emotions is the situation that the child is in. For instance, if they are facing a difficult test, then this contributes to the problem. And the third most important is cognition, the personality or the temperament of the child, which includes the child's inferences, motives, rules, self-concepts, and the way child processes the event. What do you think? In REBT, with children and adolescents, do we largely focus on inferences or the irrational beliefs? What do you think? Anyone? Raise your hands. With children and adolescents, do we focus in REBT on inferences or irrational beliefs? Jagruti?
Inferences.
Inferences, that's a correct answer. Specifically with children and adolescents. However, with adult population, we focus largely on irrational beliefs and not the inferences. However, the basic concepts remain the same. We also do work on the irrational beliefs. Excellent. So, and Jagruti has been one of the candidates of our intensive training. Good Jagruti, very good learning. How many of you think, by show of hands, when a child is brought to therapy, it's actually the parents that need therapy and they have the problem and not the child? How many of you think so? We have a lot of show of hands.
I would say both.
Okay. All right. Okay. Few people say that it's actually the parents who have the problem. Thank you. Now, there is a warning here. See, we're engaging in black and white thinking when we say that it's actually the parents that have a problem and not the child. And therefore, it is important to sort out the problem ownership, which means that to what extent is the problem the child's problem and to what extent it is the parent's problem. It is very easy to take sides when someone is narrating a problem. So although we would not say that parents are not at fault, however, not every time the entire problem is parents and not every time the entire problem is the child's problem. So it differs from case to case, from time to time, from issue to issue, different issues. If you assign adequate or proper responsibility of the problem, I'm sure that you will have better results with this. So, of course, we do work on the contribution of behaviors, feelings, and perceptions of the child. However, the parents also need to be involved in therapy. And one of the best ways to involve them in therapy is assessing the problem ownership accurately and not blaming them, however, seeking help from them to help the client, help the child. So how do we do, what kind of interventions we do in REBT with children and adolescents? I would say that before you get into children and adolescents therapy with REBT, you need to be very thorough with using CBT and REBT with adults. and then adapt it to children and adolescents, because the basic concepts of REBT may look very easy to understand. However, they may not be very easy to implement in therapy. So they look very easy. However, they may be slightly difficult to implement. Once you are very good with adults, start learning how to apply it to children and adolescents. Now, what we do is, modify the same interventions that suit children and adolescents. So I might use a story. Say, for instance, I'm going to ask you at the end of this story, which IB, irrational belief, did this address? So there was this frog and her three beautiful children playing in a pond. And once upon a time, there comes a huge animal that's grazing next to the pond. And these small little babies, they start looking at the animal in a very with awe, and they say, "Mom, look at that! That's such a big animal. It's a white big animal. What is it?" The mom says, "That's a bull, my son." And it's like, "Wow, that's big bull. Can you be big like the bull?" Mom says, "Yes, of course I can." And then the other child says, "Yes, we have seen you yelling at daddy and your throat swells up. So why don't you do it now?" And the mom says, "Of course I can do it now." And the mom breathes in air, and then, her throat swells. And then the children start clapping. Yay, mama has grown big. And then the one of the notorious naughty child says, like, "Mom, you're still not as big as the bull. Can you breathe in more air and then, be bigger than him?" And the mom says, "Yes, of course I can." And she breathes in more, and pop, she goes. The throat bursts and she dies there. Okay, let's rewind the tape. Go back to the moment where, um, "Mom, what is this big animal?" It's like, mom says, "That's a big bull, my son. Can you be as big as the bull?" Mom says, "No, I can't be. It's a bull and I'm a frog. I'm a frogess, whatever you can call it. So I can't be as big." It's like, "No, no, no, mom, we have seen you. Your throat can swell and you can be as big." So then mom says, "No, we are frogs and they are bulls. So we can't be as big as them. Hey, have I ever stopped you from playing in the mud or the water? Why don't you focus on your studies or your play? Yes, or your play. Just go back and play." And it's like, "Okay, mom." So these children, start playing. One of the child says, "Mom, please once." I say, "No." So it's like, "Okay, fine." And then they start playing in the water and they live happily ever after. And now, as a therapist, you would probably ask them, "What did you learn in this small story?" Okay, now as a trainer, I am asking you, what did you learn in this small story, and which irrational belief were you trying to target? Anyone? Dennis, she raised her hand. Yes,
Yeah.
Kunali.
So it was, I think in the first story, she did not meet the reality. She needed to talk more about what's real. In
Mm-hmm.
second story, she did say the reality. That she did show that no, it's not possible, but she did not explain it rationally why it's not possible.
Mm-hmm. Okay, that's a good answer. Anyone can tell me which irrational belief of the four I was trying to target? Thank you, Kunali. I think that's pretty easy answer if you know the REBT theory well. Anyone can raise their hands? Someone who has undergone REBT training already? How?
Or is it demandingness?
Demandingness. Okay, three more chances. All right, so I'll give you the answer. It's depreciation belief. And the aim of the story was to induce unconditional self-acceptance. Okay, people have written in the chat box assertiveness goal. All right. Okay, the answer is, the rational belief was unconditional self-acceptance, and the irrational belief that I targeted was depreciation, self-depreciation. So when we compare ourselves with others and put ourselves down, it's important that we accept ourselves the way we are. So you could tell many stories. You could use different props. Now, I use this prop pretty often. Now, this is to help children learn a specific skill. Say, for instance, this is a sponge, and I ask one volunteer from the children, and then, I ask them to dip this sponge into water and then see what happens. The sponge absorbs all the water and then it becomes heavy. And I ask the child to squeeze this sponge once again, and then all the water comes out of the sponge. Now, I teach this for a variety of things. I could use this to teach them how to receive criticism, or when someone gives you negative criticism or someone abuses you, someone uses harsh words on you, you might absorb everything like a sponge and without filtering it. So you may absorb everything and then your heart will become heavy. And you have a choice to squeeze out all that is not helpful. For instance, someone gives you constructive criticism, just let it be absorbed. Someone gives you destructive criticism, you may always let go of it by squeezing it out. So after squeezing, the sponge still remains a little moist. That suggests that the constructive criticism can be still held on to. However, you can squeeze out the destructive criticism. This way, you can use the sponge example. Children are visual learners, and they are experiential learners as well. So if you make everyone do this thing, they are most likely to learn the concept well and remember the concept for a longer time. I also use another example of bubble wrap to teach them a concept of urge and impulsivity. So if every one of you had this bubble wrap with you, you will probably have the urge to pop it, right? Right. But if I say don't pop, you will not pop it, but you will have the urge to pop it still, correct? Now, give this bubble wrap, small pieces of bubble wrap to children and ask them to pop them first and then stop. And this introduces them to the concept of urge, that there is an intense desire to do something. The desire cannot be stopped, but the behavior can be stopped. Now, once you differentiate the urge from the behavior, you say that behavior can be stopped, behavior is fully under control, but the urge is not, urge cannot be controlled. They understand that there is a decision between the urge and the behavior. So they decide to act on the urge, they can decide not to act on the urge. This is specifically for impulsivity. When someone has an urge and they do something, tell them that there is a small, very, very small gap between the urge and the action. And at that point, you can change your decision to act in a specific way. So this can be used for multiple things. You can use this for impulsive behavior, like risk-taking behavior. You can use this for addictions, like, they are repetitively checking their mobile phone or binge watching Netflix. You could use this for addictive behaviors such as, eating, emotional eating. You could also use this for avoidance, that they have an urge to procrastinate, but they can stop the procrastination. However, they cannot stop the urge. So this is the use of props in REBT for using with children and adolescents. You can use analogies in children. For instance, this is an analogy that let us imagine that the criticism appears as something on the screen. You have an option to enter or to delete it. So if the criticism is true, then you can enter it and then you can process it by, first of all, removing the label of the criticism. For instance, you are an idiot, you are stupid, you are failure, loser. Remove that label and only look at what can be modified. For instance, your behavior can be modified, your skill deficit can be filled. See, I'm having the urge and I'm popping it. I'm just going to keep it away. So your behavior can be modified. There is skill deficit or knowledge deficit that can be filled. So this way you can teach them to delete or process a specific criticism. So you can use analogies. Various analogies can be used for various concepts. I use this analogy pretty often. This is a cactus. Now, specifically after the COVID, when children have started going back to the schools, we can use this analogy of cactus. Is cactus has learned to adapt itself to very harsh conditions, and it even blooms in harsh conditions. So adaptation is a quality that you can learn, which is adapting yourself to harsh environment. It also has its own thick skin. It does not say that I wish I was in Shimla and then things would have been much nicer. But it says that, no, let me do some changes in myself. Adaptation does not mean compromise, where in compromise, you let go of your interest. And adaptation, you keep your interest in mind, which is what is your goal, you keep that in mind. However, you use a variety of strategies to achieve your goal. So you could teach, concepts like this with small little props. You can also use this analogy with children. This is a mosquito or a bug zapper. And you could say that, have you ever zapped the mosquitoes with the zapper? They say, like, yeah, we all have done that. I think that is the greatest invention of mankind in the 21st century. It's like, of course, it is. Yes, it is. So imagine that there are some negative thoughts that are coming to your head. Now observe all these negative thoughts in your head. First of all, observe, and then observe the thoughts that are not true. Just because you think something does not necessarily mean it's true. For instance, my mom does not love me. Nobody loves me. I failed at the test. Now, out of these, there is one thought that is true, and there are two thoughts that are not true. So one thought is, I failed at the test, is true. Although it is a negative thought, but it is realistic. And nobody loves me is a negative thought, but it's not true. So you could imagine yourself zapping these thoughts. So you zap these negative thoughts that are not true. You could also teach this with, zap the thoughts that are not helping you. So you could use either evidence-based strategy, which is zap the thoughts that are not true. You could use a pragmatic strategy, which is zap the thoughts that are not helping you, right? This way, they can just learn to first observe the thoughts over their head and then zap the thoughts that are not helping them or they are not true. Now, in preventive emotional education, I have, this is a photograph from our school program where we gave them first chits of specific thoughts. So this was the script of a specific emotion. And we also gave them the labels of emotions and they attached to the ice cream sticks. So they had to mix and match. So these children were able to identify the specific script and the associated emotion with it. So, in this game, we actually gave this shit to one boy and he was holding it with, with himself and showing it around that this is my script. And another boy had the emotional label with him. And then he would run around or look around in the room to find the partner. So this is finding the partner. Now, a very simple concept, but we made it into a game. It lasted for 20 minutes. It was so much fun when they exchanged their, emotional labels and they were able to find out other emotional scripts as well. So a fun game, you can include activities to teach the same concept with children. Now, this is a concept. I'm going to ask you, what can you use this with? So we asked the children to bring pots from their home, and then we asked them to sow 5 different seeds. So these were common seeds that they were found at home, for instance, coriander or cilantro seeds. There were cumin seeds or jeera seeds. There were fennel seeds or, sauf seeds. There were mustard seeds and wheat and, different kinds of daily things that they can find in their home. So they were brought to the school and they sowed them and they took care of them for like 2 to 3 weeks. And we observed that all the different saplings grew at a different rate. Now, these saplings were, some were taller, some were shorter, some were, some had more leaves, some had less leaves. Now, these are specifically adolescents we are talking about. Now, what can you use this with? What concepts can you teach children with this experiment? Say they observed the growth of these saplings over a period of time. What can you teach the children with this? Anyone? Yes, Ishita, go ahead.
The individual differences.
Yes, individual differences. That's a good thing. Anyone else? Could we teach something else? Jagruti, you raised your hand.
So I think self-acceptance, where we
Self-acceptance. Yes, Rochelle?
where we help them to each child grows at their own pace.
Have own
Each
time
child
zones.
grown as their own time zones, correct. Absolutely, absolutely right. Okay, so we teach them that each seed has a different genetic material, and therefore their growth rate is different. In a similar way, you adolescents will grow at a different rate. Someone would be taller, someone would be shorter, someone would be thinner, someone would be larger, and someone would develop the secondary sexual characteristics faster before than you, and someone will develop later. That does not mean that someone is better or worse than another person. Just like these saplings, they all have different genetic material. We cannot say that one sapling is better than another. They all have their own timeline. They grow at a different rate. So will you, right? Okay, so we taught this and they were shocked to know we didn't tell them what we're going to teach you after 3 weeks. And they enjoyed the whole process of growing these vegetables. They just didn't know what we were teaching them, but it was so much fun. They stopped comparing themselves with other people. I mean, like, at least for the time being, this needs a lot of repetition, of course. So this is what they learned. There are a variety of techniques that we could use with children and adolescents. I'm going to highlight a few. Pleasure prediction. This is for depression, where the children do not feel like doing something. Ask them, hey, let's do an experiment. When you don't feel like doing something, you could write down on the paper, how much fun would it be if I try this out for 5 minutes? And they might write down 2. And then say, for instance, going and talking to grandma for like 10 minutes, how much fun it would be. And the child says it would be 2 or 3. And then force yourself to do it and find out after actually talking to grandma for 10 minutes. And the child comes back and writes it down. So you might do 10 such experiments and learn from the experiments. What did you learn? The child will probably say that I have been under predicting the pleasure I'll get from activities. And then they might start doing these activities more. Contingency management needs to be incorporated with parents. So no punishments, either rewards or withholding the rewards or negative reinforcement. This is what we encourage parents to do. We could do a simple cost benefit analysis of specific behaviors that the child does, which is on 2 sides, write down the costs and benefits of doing this. Consequential thinking is a very interesting concept that I teach children. Here we make the children write down, make some strips like this. The first strip, let's say it has something written on it that, I play first and study later. So this is what is written on the chit, and the child makes it into a loop, staples it here. So this becomes a small loop. And then the child writes the immediate consequence of this action, which is if delaying studying would lead to, I will be tired and will be left with no time to study. So make this a loop and staple it again. So this becomes a chain. And now write down the consequence of that. So that you add on a third loop to it. So you can make a long chain. The child keeps writing consequences of specific behaviors. And then you make a different chain with the initial beginning is different. For instance, I play later and study first. So the consequences would be different. All the chain would be different. So this way, you teach the child to compare 2 chains. One is shorter and has a better outcome, and the other one is longer and has many, many different unfavorable outcomes. This is specifically because children do not have a well-developed consequential thinking. You can teach them that there would be consequences of action, there would be consequences of inaction. Say, for instance, I showed them a small potted plant, and I tell them that if you did not water the plant, what will happen? They will say that the plant will die. Now, this is a irreversible consequence. So relaxation training is something that we can use with anxiety disorders. Pleasure prediction is very similar to, okay, I've already discussed. There is anxiety prediction, just like pleasure prediction, where the child predicts that they would have more anxiety than they actually have it. So we can encourage them to test this hypothesis. Do you use systematic desensitization now? What's your stand on systematic desensitization for anxiety? Anyone? Do we use this anymore or no? We don't use this because this has been found to be ineffective. However, we use exposure-based interventions. Social skills training is a big part of training children and adolescents with REBT. What do you call homework? Do not use the word homework with children. You could use alternative names like practice, action plan, build your toolkit, self-help assignments, or stick assignment, which is show that I can. You could also use the word experiment for the next session next week. So this is how we can use REBT with children and adolescents. Of course, this is just an orientation program, and you can get a lot of information about how to use this with children with these specific books. Anne Vernon's books, like What Works When with Children and Adolescents, is an amazing set of books, actually, that helps you get ready-made handouts to use with children and adolescents in individual setting, in school setting, in preventive care settings. A lot of work has been done. You could look up for more titles by the same author, but if you're interested more with disorders, then this is a book that you can use with by Albert Ellis and Michael Bernard. So you could follow my Instagram handles like Morphic Minds and lifehacks_forever. I'll be happy to answer your questions even after the session is over. So this is all, folks. I would like to have questions now. Anyone with the questions? The age group, this this book has 3 different books in it. So it is for different age groups.
Feel free to ask questions. You may unmute your mic and ask, or you may want to type in the chat, whichever one pleases you.
How to deal with an introvert child? So when the child is introvert, they don't want to talk much, right? However, you can devise a technique where they can express their feelings. So one of the techniques I use is the thought bubble technique. In the thought bubble technique, you could draw 2 cartoons, one with a happy face, another with a sad face, because you already have assessed something about their emotions, and ask them to write or fill in the thought bubble. That's a blank bubble that you have put on their heads. So you could also ask what they feel about therapy, and encourage them to draw things or write things, or simply identify things. You could use hand puppets. Hand puppets is amazing. Use of hand puppets, they find it very amusing. Even an introvert child would start opening up if you use like, hey, I'm feeling like a failure, and oh, you failed at the test, I know how you must be feeling. And then start the another puppet, yeah, I always fail, nobody loves me. And then this rational puppet says something else. So use hand puppets, get them engaged in the whole process, but be very clear, what are you doing? Are you assessing? Are you establishing rapport? Are you establishing a therapeutic alliance? Are you establishing a goal orientation? Are you assessing emotions? Or are you doing an intervention? So be very clear with what you're doing, and then I think things should be easy. Just engage them in whatever activities. Yes.
I think Shivani has a question. Shivani has got
Sure,
answer.
Shivani, go ahead.
Yes.
So thank you for an insightful session. So my question was that what can be done for a child, like specifically like ADHD or autism, if they have difficulty with, as a therapist, you have difficulty with building that eye contact because they're not very much, they'll try to, avoid that eye contact. So in this approach, REBT approach, is there something that can be done about that?
Yeah, so now there are two different questions, one with ADHD and another with autism. With autism spectrum disorders, it all would be individualized again, that every child may have different IQ, they may have a different set of emotions. First of all, you need to understand what are we working at, right? And then, they may also have problems with establishing a relationship with you, right? So you may want to spend a lot more time in establishing a warm relationship with this client. However, with ADHD, you accept them unconditionally first, that for their behavior, which could be either hyperactive or their inattention, you accept them the way they are. I myself have very bad ADHD, so I can relate to ADHD patients very easily. I think modeling is one of the best things you could do, that you want the children to behave the way you also show the same behavior. To be specific, I would say all children would need an individualized approach regardless of their diagnosis. So have very clear understanding of what emotions are they facing. Are the primary problems of ADHD? Are there secondary problems of ADHD? What are you dealing with? So get a thorough evaluation, number one, with every child, regardless of the diagnosis. Have a good cognitive conceptualization of the client, which means that what are their dysfunctional behaviors? What are the thoughts behind these dysfunctional behaviors? And what are the beliefs underlying these dysfunctional behaviors? Then problem ownership. How much is this because of the child's cognition and how much is it external? For instance, the parents' behavior or the situation or the environment. So once you have what we call as cognitive conceptualization chart ready, I think intervention would become easy. I hope that answers your question, Shivani.
Yes, sir. Thank you.
All right. Thank you. Trupti, go ahead.
Good afternoon, and thank you, Dr. Shishir, for this wonderful session, actually. A lot to learn from you. My question here is for adolescent girls, especially, they now the trend is that most of them have boyfriends. Now, I have a client who whose daughter has a boyfriend from other religion, and the daughter is not ready to leave him, and ready to move to hostel. I mean, that is the extent that is going on actually in the family. So it's really worrisome for the mother because she's a single mother. So and daughter is not will not be ready for the counseling sessions, therapy sessions. So how can we handle this kind of situation?
Okay. Now we only have the mother who is accessible to counseling, correct?
Yes, correct.
We only have the mother, right? Now, it is important for we to understand that there is a cultural difference between the mother and the girl and the boy, right? Okay. So what we need to do is to help the mother modify her reactions towards the child so that she can influence the child better, right? So that the child and the mother listen to each other, right?
Yeah.
And explain to the mother that why is this happening? First of all, I would again say go for a thorough evaluation of the mother and the child both. And we do not know that whether this is a disorder or no, but it is leading to a practical problem for sure, right? So if the mother explains to the child in a specific way, the child may consider her mother's interventions. But currently, it looks like the child is not considering even mother's interventions. So explain to the mother, why does this happen at this age? is because of lack of consequential thinking, or there is a lot of peer pressure. We do not know why the child is engaging in a behavior. That is not, that is inappropriate as per the mother, right? So do not take sides, but help the mother, again, establish our communication with the child more. Again, thorough evaluation of both of them.
Yes. But the evaluation of the child is a bit challenging, because definitely she will not be the part of the therapy session, actually.
So evaluation is a challenge. We could only help the mother communicate better with the child. You might ask the mother, how does she feel when this happens, specifically that the child does not listen to you? And then what does she do when the child does not listen to her? And explain her the difference between discipline and obedience, explain her the difference between impulsive behavior and something that is non-impulsive behavior. So you could probably help the mother communicate better with the child. That's it, but you can definitely say that we have limitations here.
Sure. Okay.
All right.
Thank you.
Thank you.
So
Difficult
much.
question, no specific answer. Again,
yeah.
Help the mother as much to communicate better. So we have a question, how to deal with a stubborn child and child who doesn't listen out. When I say no to my 5-year-old, I hate you. Okay, so now there is no blanket answer to this again, but I'll give you one specific clue that you hate me or certain specific things that I do. Then the child may say that, I hate it when you pull the mobile phone away, or you keep telling me to study and you don't let me go out to play. So you hate certain things about me, right? And then that end of the discussion. So again, you may also talk, what are the things that you hate? And then this is one that you may list down, the child may list down what are the things they hate about you. From I hate you, I come to I hate certain behaviors. Then the 5-year-old does not have very good logical thinking, and that's why they probably think that whatever they are doing, whatever you are doing, is probably against them. This is because of the developmental deficit. You need to stay calm. You need to help the client understand that there are many reasons for the same thing. So say, for instance, the baby is crying. There could be 3 different reasons why the baby is crying. Similarly, when I say no to you for a specific thing, what could be the other reasons why I say no? However, the child is just 5 years old. Again, we will have to evaluate the child. And I would expect you to model calmness and patience with the child who is not listening to you. You also probably need to understand that there is a difference between discipline and obedience. For how many sessions? We would usually recommend 8 to 12 sessions for adults and children both. How to deal with a boy child who is struggling with acceptance from, I'll just come back to all of you. I'm just answering the questions that have been written. Acceptance from other boys because he's more in touch with his feminine side. All right, okay. So here, again, very good role modeling, and accept the child unconditionally for their behavior. And you explain to them, gender roles, and how society has, has the stereotyping, the difference between stereotyping, distribution of work, and so on. And if you accept them unconditionally, just learn to accept unconditionally. So teach them how to accept yourself unconditionally for whoever you are, right? So I think unconditional self-acceptance, if they accept themselves unconditionally, it would matter very little to the person if others don't accept, right? Yes, go ahead. Somebody had a question. Okay, what do we do when children are totally shut down for a long period of time? The first thing you need to do is to evaluate. How do we help kids who want to play all the time and find study no fun? For half an hour, you could play with them. That's the best thing you can do. And while playing with them, you will understand that, yes, playing is fun, and that's why they are playing. However, you could have a family discussion about the time of play, when would they play, where would they play, and what would be the consequences of overshooting their time. Say, for instance, you have dedicated 2 hours of playing, and they have exhausted the data, exhausted the quota of that day, and then they overshoot by half an hour, right? Then you may want to deduct this from the next day. So if you have a very clear and firm understanding of this, be it screen time, be it play time, and be a little flexible. You could be flexible. You can have a 20-minute extra, but not more than that, right? Okay, so have a consequence associated with overshooting time. Okay, I think we still have questions. Please ask these questions on my Instagram pages that I have already given. This is, I'm going to type the Instagram IDs here. All right, anyone has verbal questions?
There's one written one. How to work with a child who has low frustration tolerance during their school and house obligations.
Okay. Now, low frustration tolerance, what do you mean by low frustration tolerance? In other words, how is it expressed? How is it expressed? Low frustration tolerance, how is it expressed? It is expressed in anger, or is it expressed in, not doing work, daily chores? First of all, you model high frustration tolerance, have very clear agreement from the children that what is expected of them. Have a little higher expectations. Having high expectations does not mean that your children won't do it, right? So have very clear expectations, have rewards associated with these behaviors that they do. And if they don't do the behavior, have the consequences associated with it, right?
Shishir, I don't know whether you have seen a question from Prishali. How many sessions would therapy go for one child?
Around 8 to 12 sessions.
All right.
Okay, somebody asked me for Twitter ID. It's the same thing, Shishir Palsapure. All right, thank you very much, everyone, for your patient listening, and a repeat telecast of what we I would say, performance of what we did yesterday. It's been great interacting with you. Thank you, Professor Alvin, for always trusting me and giving me this opportunity to interact with people. Okay, bye-bye, and have a wonderful Sunday ahead. Take care.